As the opioid crisis rages on, pain specialists are looking into alternative ways to treat pain that don't rely on addictive prescription painkillers. In fact, a drug-free approach is offering people an effective way to manage their chronic pain. Here, I'll be talking with the two of you about this tactic, this drug-free tactic in fighting the opioid epidemic, both as Dr. Joseph Prager, director of the Center for the Rehabilitation of Pain Syndromes at UCLA Medical Plaza, along with his patient, Andrea Sherman. Dr. Prager, what constitutes pain as chronic versus regular pain?
Chronic pain is what happens after acute pain. We expect acute pain after surgery. We expect acute pain after a burn or a cut or a fracture. But when 3 months pass and the original problem has often healed and the pain persists, that's chronic pain, which is a devastating condition that causes needless suffering, can have big impact on the family and also the ability to participate in the workplace, never mind the potential of getting involved with addictive medications, as you've been talking about.
Okay, and how serious is the burden of chronic pain?
Well, Dr. Goodwin, that's a really good question. I mean, it turns out that in the economy of the United States, about $635 billion, according to studies, have been lost annually because of chronic pain. That's two-thirds of $1 trillion because of healthcare costs and also because of lost time in the workplace.
Okay, so it's a major problem.
It is beyond a major problem. I mean, the addiction problem is, I mean, you know it's a crisis. I mean, there are 3 different government agencies that have put out crisis alerts about it.
Right, and we keep hearing about the opioid crisis.
That's true. And I mean, most patients start off, the largest number of drug addicts start out through prescription medications that are either prescribed to a patient or diverted by a family member to become addicted.
Okay. Andrea, how did your chronic pain affect your life?
Well, I was working and I just was starting my career and I was injured on the job. Someone had bent my wrist back messing around and I heard a pop and that was it, and I lost the use of my arm. And it was devastating, both physically and emotionally, and otherwise I became completely disabled. I was right-handed, and so there went that, my ability to write and my ability to really function. And I tried everything. I tried opioids, I had physical therapy, occupational therapy, everything, and it was really, really hard. I was newly married, and then I had 2 small kids, and nothing worked. I couldn't sleep, I couldn't work. And then someone referred me to Dr. Prager, and we tried a spinal cord stimulator, and I called him the day after the procedure, and I said, this was the first decent night's sleep I had in years. When do I sign up? And a month later, I had the device implanted, and my whole life changed. I started to feel like myself again for the first time in years. I could sleep, I could function, I was able to raise my kids on my own, start a business, and really re-engage in life again like a normal human being. It was really a godsend.
So now tell me, Dr. Prager is in UCLA. Are you in Los Angeles?
I am at UCLA.
Yes, and Andrea, where are you located?
I'm in Los Angeles as well, luckily that I could find him.
Right, okay, I was just curious about that. Dr. Prager, tell me, is the medication or the neuromodulation approach available nationally, or is it in just some locality?
No, it's actually, well, maybe in some rural areas it may not be so available, but it's available all over the United States and essentially all over the world.
I see. Okay, that's good to know. Now, with the opioid crisis, as we keep talking about as a national emergency, tell us about this non-addictive approach to treating chronic pain that you use.
Well, it's time to get out of the drug fog. We replace medication with tiny amounts of electricity applied into the nervous system that stop signals from going to the brain. We have a small device that sends the signals, and so when they come in to the nervous system, they don't go up to the brain. And when they don't go up to the brain, not only do you not feel the pain, but you don't suffer. And suffering is a thing that goes beyond feeling the pain.
I see. So now, explain again a little bit more. Is it oral medication, or is it what other kind of approach do you use?
Well, this is electricity instead of medication. And this is something that's been proven in studies to work. You have a non-invasive trial, a minimally invasive trial, where a wire is placed, and that helps you decide if you want it, as Andrea was talking about. And if you want to find more information about this, Dr. Goodwin, the best thing to do is to go to the website askaboutpain.com. That's askaboutpain.com. It's a website that not only provides more information so that your viewers can get additional information about this technology, but it also gives you a list of board-certified, experienced, qualified physicians who can provide this useful therapy to the patient. And once again, that's at askaboutpain.com.
I'm glad you gave me that information. I just made a note of it. Askaboutpain.com.
That's right.
And that will answer a variety of questions related to the neuromodulation approach, as well as a list of experts.
That's right.
Okay, well, that was very helpful information received from you and from Andrea. Andrea, how are you doing now?
I'm doing great, and all I can say, Dr. Goodwin, is if anyone out there is suffering from chronic pain, it's definitely something that they should consider.
Go on.
And it took away what was sharp, burning, stabbing pain, and now I feel nothing. I just feel great, and it's a great way to live life.
Okay, well, you're a good witness for the method, a good survivor.
I am.
Right. Okay, well, let me thank both of you for this information. I'm sure it's going to be helpful for my Health Power audience, and I will share it with, in fact, they're hearing me because we're all three of us talking at the same time, and they're also able to see you. So we've had an interesting chat, and it was useful information. Let me thank both of you for talking with me today.
Well, thanks for giving us the opportunity to spread the word. And once again, go to askaboutpain.com if you want to find more.
I certainly will.
Thank you.
Thank you.
Okay, have a good day, both of you.
You too.